Lord, if you will, look out over us and give us your hand today to guide us as we take care of our patients and give them your love.
Sumter Faith Clinic is a free medical clinic in Americus, Georgia. We see patients who do not have insurance and offer free medical services. To get the clinic started, we pulled from our own funds.
After Hours Care was where Anna and I are employed, and it was capable of giving a great deal of supplies and equipment and furniture. We had a phone call from a gentleman at the Presbyterian church in town, and he said, I think I have some space available if you're still interested. And that's how you can run a free clinic. Nationally, there are between 16 and 19% uninsured patients in the United States, and I really think that the number here is a little bit higher. Mommy can sit with you in her lap. And there are some programs that are available that are very good. Medicaid, WellCare, Peach Care, but Sumter Faith Clinic serves a group of people who don't qualify for those public programs.
Hey, Miss Benson.
Hello.
Hey.
I use the free clinic because I recently lost my job, so we no longer have health insurance. If the Sumter healthcare was not here, we wouldn't have healthcare, period.
When you get done with the antibiotic, I'd like you to come back just so we can take a look at it and make sure it's completely gone.
Okay,
Okay?
great.
All right. With today's economy, people are finding themselves in situations where they're having to choose between a roof over their heads or food for their family, and their medical care tends to take a back burner to that.
All right, thank you so much, sir.
Thank you
If
all
you need
very
us,
much.
we're here. We provide two kinds of services. Chronic care for those people who have blood pressure issues, they have diabetes issues, and these are people who we can help on a day-to-day basis through maintenance of medication and the monitoring that they need. We also take care of those people who are incidentally sick, like sore throats, runny noses, coughs, urinary tract infections, those things that need attention, and without attention can become much more serious.
Where's your head hurt?
Just like tension. When I go to the emergency room, it just costs too much. I don't have health insurance, I don't have Medicaid, but it helps to come here because they help you, you know, when you can't afford it.
Those patients who utilize the emergency room and cannot pay for those services, that cost has to be spread amongst us. And so by eliminating a need for a patient to visit an emergency room, we are really helping to cut cost a little bit to each and every one of us. Yourself, do those exercises before you get out of bed in the morning. We're able to operate a free clinic in today's economy because so many people are still willing to give.
The clinic is free. Our services are donated by local nurse practitioners and physicians. Our staff is made up of RNs and paramedics and people who donate their time and their services.
The day that Anna and I publicized this, 15 people walked in the door. Now we've got somewhere over 32 volunteers.
Good job.
We actually have a written budget of only $2,000. That just helps us pay for the phone and the electricity, and that's all we need. We are capable of identifying those things we need to find for our patient and then going out in the community and begging or borrowing or whatever it takes to get it done.
How are you?
You do.
Good, good. They were telling me that you were wanting some prayer.
Yeah.
Okay, go for it.
No, I just like to, to pray for things to get better for me.
Okay.
I just need help, with so many things.
It was very important for us to not only address patients' physical needs, their health and that type of thing, but also to address their spiritual needs.
The spiritual benefits are wonderful. They'll pray with you. They treat you as a person rather than a number. You're treated with respect, and no matter that your income is low, they don't look down on you, or you don't feel like they're looking down on you.
I think there's a need for Sumter Faith Clinic in every community because I think that there needs to be a place where people can receive care without fear that they're going to end up with a bill that they cannot pay. But more importantly, people like me can get that feeling in their heart of fullness that they've actually done the work of the Lord.